Hello everyone. A 5-year-old child can suddenly lose their bladder control. A patient with spinal cord injury may urinate involuntarily, yet a healthy adult can hold urine for hours. So why does this happen? And the answer lies in the fascinating physiology of micturition reflex. So in this first part of the micturition reflex, uh, I'll make you understand about the structure and the neural control over the bladder. Until and unless you understand uh, the autonomic nervous system, you cannot understand this micturition reflex. So let's start the lecture. Now everyone knows that CNS, central nervous system, has brain and spinal cord, and which part of the central nervous system is the relay center. So thalamus is considered as relay center of central nervous system. Why it is called relay center? Now there are two thalami, and why it is called relay center? Because most of the fibers, sensory and motor fibers pass through this structure, which is called thalami. Now anteriorly and inferior to this thalamus, there is a sheet of gray matter. This sheet of gray matter is called hypothalamus. Now ventromedial aspect and dorsolateral aspect of hypothalamus. This dorsolateral aspect, which are which are which are the most important part that controls urinary bladder, because they are the origin for autonomic nervous system. Now we all know that brainstem has three parts: midbrain, pons and medulla, and spinal cord. And the spinal cord is the continuation of medulla. And this is anterior part. Clear? Now ventromedial part is concerned with parasympathetic system, whereas dorsolateral aspect is concerned with sympathetic system. So sympathetic system originate from dorsolateral aspect of hypothalamus, whereas parasympathetic system originate from ventromedial aspect of hypothalamus. Now sympathetic fibers goes downward with there are polysynaptic pathway. These fibers descend downward bypassing the brainstem, bypass brainstem, bypass cervical region, and eventually communicate at the level of thoracolumbar region. T12, T12, and L12, 2 and 3. That's why This sympathetic system is also called thoracolumbar outflow, whereas parasympathetic originate from ventromedial aspect. And fibers from this ventromedial aspect through the polysynaptic pathway they descend downward, and during descent they communicate with motor nuclei, cranial number 3, 4, cranial number cranial nerve number 7 and 10, and these fibers descend downward, bypass the cervical, thoracic, lumbar region, and finally in the sacral region S2, 3 and 4. They communicate with S2, 3 and 4, and from that part preganglionic fibers are coming out. So that is why this parasympathetic system is called craniosacral outflow. Craniosacral outflow. Right? Why sympathetic is thoracolumbar outflow? Because the fibers that originate from the dorsolateral aspect, they communicate with preganglionic fibers that are coming out from thoracolumbar segment. So sympathetic system is called thoracolumbar outflow, whereas parasympathetic is called craniosacral outflow. Now here is the cross section of spinal cord. Posterior sulcus, anterior sulcus, and posterior gray horn and anterior gray horn. Now gray horn, you know that gray matter is the collection of cell body, whereas white matter is collection of bundle of axons. Now posterior gray horn is concerned with sensory system, whereas anterior segment or anterior gray horn or ventral gray horn, which is concerned with motor system. So motor fibers are coming out from anterior gray horn, and from the sensory nerve fibers through the dorsal root ganglia, they enter into spinal cord through posterior gray horn. Right? Now, so from where these autonomic fibers are coming out? Now there is another horn which is present between anterior and posterior gray horn. Now fibers that are coming out from this horn in this horn is called intermediolateral horn. These fibers are autonomic fibers, sympathetic or parasympathetic. Now if this segment of section of spinal cord is at the level of thoracolumbar segment, these fibers are sympathetic fibers. If this section is from the sacral segment, they are parasympathetic fibers. Now this much you need to understand in order to understand the neural control of bladder. Okay, so that we will discuss in next lecture. Thank you.